Tonight, King 5 exposes that the VA failed to successfully roll out a program aimed at helping certain veterans suffering from mental illness.
Congress passed the law last year to reduce the risk of suicides among one of the most vulnerable groups of veterans. But as our Taylor Mirfendereski found out, many don't even know that the new help is available.
You regret what happened?
Absolutely, every single day.
One decision in Afghanistan ended Brand McKeon's 9-year military career. The former JBLM Special Forces medic was on his second combat deployment in June 2018 when he broke the rules.
Why did you take that medication?
I don't know. It seems surreal that I did that.
After one combat operation, he overdosed on Oxycontin and Vicodin pills, and in February, the Army kicked him out. Now McKeon is among thousands of veterans discharged under other than honorable conditions, and because of that, he doesn't automatically qualify for VA benefits like health care.
But I still think people that serve their country and have trauma because of that should be able to get help.
The VA has a separate process to decide if vets like McKeon should get the benefits after all. For some, that VA decision takes longer than a year. Too long for the other than honorable veterans who need help now.
I've literally been punching my steering wheel and screaming at the top of my lungs in my truck because I'm so just set off by things. Yeah, it's a daily struggle.
In 2017, the VA opened the door for other than honorable veterans to one specific benefit: short-term mental health care for vets in crisis. Then last year, Congress expanded the program. The VA is now required to offer not just a few months' worth of help, but ongoing mental health care to certain other than honorable veterans. And a veteran doesn't have to be in crisis to qualify. The agency had to notify eligible veterans within 4 months.
You never were notified that you qualify for mental health care?
No, I was never notified.
More than a year later, many vets who are eligible don't have a clue. The VA's first direct outreach, this letter sent to thousands of other than honorable vets in January, nearly 1 year after the new law took effect. Veteran advocates around the country, like Portland neuropsychologist Robert Stanulis, say the VA blew it.
Why are we not treating it like we would if it was a public emergency? There would be billboards up, it'd be on TV, it'd be on radio, it would be inescapable.
He says sending out one letter isn't enough. Many of these vets are homeless. The VA's own data shows they've failed to reach these vets. Officials estimate there are 500,000 veterans across the U.S. with an other than honorable discharge, a group researchers say face an elevated risk of suicide. But according to a spokesperson, in 2017 and 18, few of them received mental health treatment at the VA, less than 1%. Last year in Washington state, only 16 other than honorable veterans got VA mental health treatment. The year before, the number was even lower. Just 5 people got treatment. And remember, these are numbers for the 2 years VA policies changed to improve the system.
And would I say we're doing enough? No, I mean, the numbers speak for themselves. We obviously need to be doing more, and we can always work harder on doing more.
Jesse Markman is the Associate Chief of Staff for Mental Health, the VA Puget Sound Medical Center. He says local VA officials are trying to spread the word in the community, and he says mental health staff are always prepared to help veterans who need it.
I mean, we're interested in providing them health care.
Markman said local VA employees were trained on the new law to make sure veterans who may be eligible aren't turned away.
Did everybody become an expert in it at that point? Probably not, to be honest with you.
It's no secret that the VA eligibility process is a complicated one. So we wanted to know, do the frontline VA employees who greet other than honorable veterans know enough about the law to tell them it's an option? And how would they respond to McKeon, who's seeking treatment for PTSD? We tagged along with him on a recent trip to American Lake Medical Center to find out. We stopped at the eligibility counter. McKeon told the receptionist he wanted to start seeing a professional for mental health. She tried to help McKeon, but she gave him the wrong info before finally finding an email from her boss about the new law, though she struggled to explain it.
So in the span of one conversation, you had been told
3 different things on one issue. Only mental health care, and I still got 3 different answers.
Leaving this veteran more confused on his way out than he was when he came in.
Now, we told local VA officials about that confusing interaction, And they assured us they would be able to retrain the eligibility staff to make sure they fully understand the new law. National VA officials declined our repeated requests for an interview, and when we asked what they plan to do to reach more vets, they didn't respond. But Mark and Lori, what people are most concerned about is that there's a tiny window for the VA to reach these vets, and if they have a bad experience, they might never come back.